Hello, Ray Taylor. My name is Sierra Copeland, and I'm going to be doing dementia in older adults. Alright, dementia is a condition characterized by progressive or persistent loss of intellectual functioning, especially with impairment of memory and abstract thinking, and often with personality change, resulting from organic disease of the brain. This impairment comes in many different forms, from Alzheimer's disease, which is the most common, to vesicular dementia, Lewy body dementia, Parkinson's disease dementia, Creutzfeldt-Jakob disease, Huntington disease, normal pressure hydrocephalus, and Wernicke-Korsakoff syndrome. There are two different types of dementia, while also encompassing those others. There's long-term and short-term memory loss. So long-term memory loss is when people forget memories they remembered from their whole life and that happened a long time ago in their lives. Something that should be second nature is now unknown. This is like whenever they forget people from their past or what they used to do as a job. All this stuff that should be cemented in their brain is not no more. And then there is short-term memory loss, is when someone can't remember what they did or didn't do an hour to 5 minutes after it happened. It can seem the memory goes in one ear and out the other. This is like when you have a conversation with somebody and either they lose track of their thought and don't know what they're talking about in the middle of the conversation, or you just had the conversation and they'll ask you the same question again because they don't remember it. It was like the encounter went in one ear, didn't stop, and went right out the other. It may seem that they aren't listening, but they are. Their memory does not have them hold on to it. Normal adult development is from age 70 and up. People at older ages range in terms of agility and health. This means that they're a little bit slower, they're not as agile as they used to be, and their health starts to decline. Sometimes it's not by much, but other times it's drastically. There's decreased sensory ability, so knowing stuff around you and everything. There is decreased muscle mass and strength, where you lose your muscle mass and your strength is about 50%, maybe more, of what it used to be. There is heart issues like heart disease and having to take medicine for your cholesterol and everything. There is hair and skin changes, which is hair graying and wrinkly skin. And there are immune system issues where your body can't fight off disease and sickness as well as it used to. And memory issues. These are all normal older adult development behaviors that happen as you age. The impacts of dementia. The effects of dementia is wide range, but they all have a drastic effect on how the person acts and thinks of themselves as. There's memory loss, mood swings, disorientation, and depression. Memory loss is when, as we already talked about, you don't remember what happened in the past or just recently. There's mood swings where you get angry because you either don't know where you are or what's happening, and so that causes you to get angry with yourself and others. There's disorientation, as I said, where you don't know where you are or what's happening because you don't remember what has happened in the past few minutes or the past hour. And then there is depression, which is oftentimes it's normal with dementia patients because they feel that it's their fault that they don't remember things, even though it is not. It's genetic and their brain just happens to do this. Early prevention. There is no way to prevent dementia because it is genetic. It is just a waiting game of when the dementia will take effect. There is plenty of suggestions to try and delay it, but they aren't scientifically proven. Just the regular things people do to stay healthy as they get older. Dementia runs through genetics. Some may get lucky and it doesn't hit them in their genetics, and so they may be able to skip out, but mostly they fall to the fate of their past relatives have suffered with it. Dementia disparities. There are racial and ethnic disparities, which means there's a higher chance of dementia in minority groups. And then there's socioeconomic disparities, which could be your living conditions, environmental factors of where you are, and insurance and financial barriers. And then there are gender disparities, which means dementia is higher. There's a higher chance of having dementia in women. And then you also have the caregiving burden of people, your family, who has dementia and have to be taken care of because they can't take care of themselves anymore. And then there's access to specialized care. Effects on confidence in older adults. Dementia in older adults can drastically affect their well-being and mental health. This disease makes them uncertain in everything they do. Since older adults have lived most of their life learning things and growing their wisdom, they can get angry when everyone starts to question their decisions later in life. It can also lead to severe depression, to them isolating themselves away from everybody else because they are embarrassed of their dementia. And this means because their depression is so severe because they don't know who they are or where they are, and that just leads them to lose their sense with themselves. Retirement facilities and caregivers. Retirement facilities, memory loss patients sometimes get moved to a facility that specializes in their care. While it is good that people there know how to handle them and de-escalate situations if they are disoriented or angry, it can be hard for the patients who have been taken away from their home to know where they are and it not being something they're used to. Caregivers. Caregivers are an option for older adults. That way they can stay at their home and have someone take care of them. This is good and bad because yes, you are in your own home, but it can be startling to have someone random all day, every day with them, especially when they don't remember the caregivers. So they are often seen as glorified strangers because no matter what, if you see someone one day or if you've seen them for the past week, you're not gonna, it depends on your level of dementia, you won't remember them the next day. So it's gonna be like starting all over again. Sundown syndrome, also known as sundowning. Sundown syndrome, also known as sundowning, refers to a pattern of behavior that occurs in some individuals with dementia, particularly Alzheimer's disease, in the late afternoon or evening. During this time, people may experience increased confusion, agitation, anxiety, irritability, and restlessness. This phenomenon typically worsens as the day progresses into the evening and night. While it is not fully understood, sundowning can be very distressing for both the person experiencing it and their caregivers. My grandma had short-term memory loss dementia, so for the last 6 years of her life. At first, it was hardly noticeable because it wasn't developed yet. Just occasionally she would forget, but in her last 2 years, she started to forget faster. By her last 2 years, we weren't comfortable letting her live alone in her house in case something happened. So we put her in a retirement home because we couldn't take care of her, and she hated it. Because she had short-term memory loss, she couldn't remember why she had to go there and how long she had been there. By her last year, she couldn't remember a conversation 1 minute after the convo ended. Thankfully, she didn't forget her family before she passed, at 89 years old suddenly. Here's some pictures of what dementia can do. It can cause like memory issues, thinking, perception, judgment, reasoning, language, and attention concentration. and these are my references. I looked up one video by the U.S. News Health, and then I also looked up another thing on National Institute on Aging. Thank you.